all wait for the number of cases in India to come down. It's all about flattening the curve, isn't it? Coronavirus cases have topped the 2 lakh mark globally. In India, the cases are above about 150, and stringent measures are being taken across states and cities to ensure that cases don't increase. The biggest measure so far, of course, is self-distancing, isolation in some cases, making sure that there are fewer people out on the roads, work from home in offices, shutting down schools, malls, etc. All of that is on. But at the end of the day, for India, the biggest challenge really is to make sure we flatten the curve, that we don't even reach a stage where we have a huge avalanche of cases like stage 3, what we have seen in Italy, in South Korea, in other nations. Today, I have some of the top voices in the healthcare business to get us their perspective on how India can do this, where we stand in terms of testing is where we need to move next. Should private parties be pulled in? Remember, this is something we've been discussing ahead of the curve right from Monday on the India Development Debate. And today, I'm glad to have with me on the show Kiran Mazumdar-Shaw, CMD of Biocon. I have with me Viren Shetty, Executive Director and CEO of Narayana Health, and Ashish Jha of Harvard Global Health Institute. Welcome to all of you, and thank you for joining us on the show this evening. To Viren Shetty. Viren, in the healthcare industry right now, we've seen a hugely challenging time, especially for the private sector, wondering where it can come in. Can you tell us what the experience has been like so far?
Yeah, it's been an extremely challenging time for us. One is that our hospitals operate at almost over occupancy. We have a huge amount of patients waiting on the OPD. All our ICU beds are almost always full. So even on a regular day, we simply are not able to deal with the surge in new cases. And now our biggest fear for us right now across all hospitals in the country is cross-contamination. That is, a patient who may be a carrier of the disease, who does not know he is a carrier, and he infects either the staff or someone in the hospital, and they in turn infect other staff. There are 2 hospitals that we know of so far, one in Kerala, one in Bangalore, where the entire hospital operations have had to shut because a patient was brought in who had COVID-19. He did not know it. He may have displayed symptoms, but then he was highly infectious. And so that disease passed on to other nurses and doctors, and they had to shut down the operation of the hospital.
Viren, in fact, you had within the group a situation like that in the Cayman Islands as well, isn't it?
Yeah. So there was a patient that came to us on a cruise ship, a very senior gentleman. He had 2 heart attacks, and he was almost on the verge of death. And so we brought him in and we took care of him, and he was completely non-symptomatic. But what happened was 8 days after his recovery, he started displaying symptoms. He went into respiratory shock, and the poor man eventually passed away. But in the meantime, 40 of our nurses had to be quarantined. And so it's situations like these that really stress for us the need to flatten out the curve, to spread out the distribution of cases, and also to allow testing throughout the country. Not just clustering it within a few places, but we need to have rapid tests, we need to have testing prematurely, we need to have testing at the point of care at hospitals, so that we're able to easily isolate and contain the spread of this disease.
You know, that's a very interesting take, Viren, because right now India's approach has literally been just to confine testing to those with symptoms plus travel history. We have not started any kind of community testing yet. There were randomized testings that the ICMR did and found that there was no need for it right now. But you're saying that, your experiences show that community testing may be the need of the hour, and we need to expand and widen that ambit?
See, 70% of the cases are very mild symptoms. Most people will go through this with nothing more than a cough or a mild cold or a fever, and they don't take it for anything more than what it is, given that this also overlaps with our regular flu season. And so what's happening is that we get a lot of cases where people are viral carriers without even knowing it. And so from a hospital perspective, it's very difficult for us to do our job unless we can very rapidly identify patients who could be carriers or not.
Okay, let me get Ashish Jha in on this. And Mr. Jha, great to have you on. We have in fact been talking about exactly what Viren Shetty is saying from the last few days, that should India be testing more, or are we doing fine right now? And there have frankly been varied views. One view is that if we start this mass testing, is our healthcare system going to be ready to deal with the after effects of it? Will we have more cases? Then in that case, is the kind of controls we have over testing the reason we have fewer cases? Please do weigh in on some of these factors.
Yeah, good. So hello. So basically, we have been tracking, our institute has been tracking the global response to the coronavirus. And there are essentially two models to follow. There is the South Korea, Singapore, Taiwan model, or there is the Italy, US model. The South Korea, Singapore, Taiwan model is you test early, you test a lot, you identify everybody who's got an infection, you isolate them, and then you test all of the people they've been in contact with, and you have a very aggressive testing approach. What that does is identifies patients early, and it staves off widespread community infections. In Italy, in the US, across much of Western Europe, there's been a real slowness to testing. And what that has meant that the disease has gotten quite widespread across the community. And that has caused a lot of problems. Italy right now is overwhelmed with the number of cases, and we're going to see very similar kinds of stories in Spain, in Germany, in France. They are having to put in very substantial social distancing measures. So for India, I think there is a window of opportunity, and I would say that window is probably the next week or so, where I would very strongly recommend much broader testing, testing of anybody who's been in contact with anybody who's been identified as having coronavirus. India has done, we think, about 11, 12,000 tests so far. It should be ramping that up much more substantially. Any place they find any cases, there should be broad testing around that patient.
Mr. Jha, the fallout of that then is the question. If we have a large number of people, and that may happen one way or the other, how will our medical system deal with it? Even social distancing, to be honest, still is an experiment, isn't it? You have large congregations of people, religious gatherings taking place, protest sites are still on, and you have all of these issues. So then the next question is, what if the numbers do ramp up?
So there is no question in my mind that numbers in India are going to ramp up a lot over the next couple of weeks. The question is, do you want to know about it, or do you want to close your eyes and hope that it just goes away on its own? It does not go away on its own. So look, if you identify cases now, you can isolate those people, you can keep them away from large gatherings. I actually think it's very important to try to avoid any large gathering, at least for the next few weeks, as India sorts out how many cases it has. It has identified 152 cases. Based on the numbers, hospitalizations, my guess is that India probably has 5,000 to 10,000 cases already. The numbers we're seeing are very, very low because they're just not being tested. And broader testing doesn't mean you have to hospitalize all those people. It doesn't mean you have to do anything. Majority of those people will be very mild symptoms and they can rest and recover at home. But you have to know who they are so you can isolate them.
I want to, welcome Kiran Mazumdar-Shaw into this conversation. Ms. Shaw, we've been talking about testing and whether India is testing enough, and this is a question we've been asking for the last few days. And now India's position seems to be to restrict testing as of now to those with symptoms and those with travel history, and it's worked okay. We have relatively fewer cases. Do you think there is a case for more tests?
I certainly believe that we need to step up our testing, because I think you see that in India we are only testing 5 to a million persons in the population, which is a very, very low testing rate compared to every other country which is in the thousands. So I really think we need to step up our testing. So, as if you're going to test very few people, then obviously the numbers are going to remain very small. But already we are hearing about people who are, who are infected, and we don't know how many others they have infected. And unless we actually start testing people, I don't think we will know the actual incidence of this infection rate in this country. Now, I think the private sector has definitely come forward saying they can increase the capacity of testing, and I think the government is willing to, take advantage of this offer of help. More than anything else, I think even in the US today, you can see that they have only focused on testing on a mass scale. So I think we really have to step up testing. And as the previous panelist said, I don't think there needs to be a serious concern that everybody who tests positive is going to be serious. I think almost 90% of those who have been infected are going to get away with a mild or sort of slightly harsh form of the flu. But I think the only people at risk are the elderly and the people with comorbidities, and we should try and aim to get our the death rate down below 1%. That should be the objective. And I think this is what countries are doing. So I think having this quarantine is extremely important because the social distancing actually brings down the contamination level and the infection levels. And that's what we need to do in this phase. And once you do that, and once you make sure that the people who are self-quarantined and who are quarantined are not showing signs of infection, and especially if they're negative in terms of the coronavirus, then you're in a much better position after the quarantine period is over. But if you don't act now, then I think you do run the risk of having a large blown epidemic.
So, Ms. Shaw, what is your assessment of the measures that we're taking so far? State governments and the central government has taken the social distancing measures pretty seriously, and the rest, of course, is up to individuals. So you have cases of people who are supposed to be quarantined trying to escape and getting caught on trains, which is just pathetic, really. But do you think social distancing is going to help? A little while earlier in this conversation, one of the speakers said that there is no question that the numbers will increase dramatically. Do you also believe that we will have to see larger numbers before we can move towards flattening the curve?
Well, I think those comments are absolutely true. But having said that, we know that the coronavirus, COVID-19, is being spread through traveling. And I think what India has done, at least in a way, in a good rapid response manner, is to make sure that all travelers who are now coming in are being quarantined or asked to self-quarantine, and that anyone who has come from the sort of epicenters are being checked. And those with symptoms, of course, are being checked anyway. But I think this at least is a good measure that they have taken. The only problem is we don't know how many people have entered the city before all these quarantine provisions were set in. Because we must remember that the COVID-19 epidemic started way back in January. The measures we've taken are now in March. So people who have come between those that time, we don't know how much they have infected our population. So therefore, the previous panelist is right. The numbers could be much larger. But I think what we need to also take comfort in is that, if we haven't seen serious cases of respiratory disorders having to be hospitalized or needing ventilators, it means that quite a large number of people may have just gotten over a bad flu. So, but we need data, we need evidence before we can actually comment on all these hypotheses.
Ashish, the concern is that as and when the numbers go up, and we're seeing what's happening the world over, eventually it is the public health system which is going to have to take the load. It is, your frontline medical workers which are going to have to step in. What is your assessment of India's preparedness for an eventuality like that?
Yeah, I think this is why it's so incredibly important to get ahead of this, because and remember, the reason you don't have very many cases, we don't have very many cases in India, is because there's not extensive testing. But that doesn't mean that there aren't actually quite a few people infected. The data across the world is about 10 to 20% of people end up needing hospital care, and about 20% of those people end up getting very sick and needing ICU care, so about 2 to 4% of everybody who's infected. If the infection really starts spreading more broadly across India, India does not have the hospital capacity, does not have the doctors and the nurses to take care of millions and millions of new hospitalizations or ICU care, which is then going to be very devastating in terms of people are going to die unnecessarily. So it is absolutely critical in my mind to try to get ahead of this by testing, identifying sick people, and quarantining them, separating them, and doing all the social distancing stuff. Otherwise, I think the Indian health system is in no way prepared to deal with a large onslaught and a large spike in cases. The point I was going to make was that it's worth remembering that from the day of infection to the time somebody gets sick enough and needs hospital care or ICU care can be 10 days or even up to 2 weeks. And so if we're not seeing a lot of it right now, it doesn't mean that in 10 days or 2 weeks, we won't see a lot of it. And the experience in country after country has been that unless you take a very aggressive testing and isolation approach, the disease gets into the community and spreads. At this point, I don't think border controls is going to keep India out of trouble. The disease is already in India. Now India has to decide how it's going to deal with its own cases. And so I think border controls are fine, but that's not the primary strategy. It's got to be testing and isolation. There really is no other way that we know how to deal with this.
Viren, my question is that what happens when the numbers go up? We've seen an appeal for private companies to come ahead and test for free. The first response from them have been that maybe we can't do this for free unless testing kits are provided by the government. It's possible that hospitals and medical centers will also be called upon sooner rather than later. Has that conversation begun? What is the level of preparedness? Because clearly the public health system is not going to be able to deal with the barrage of cases going to come in.
Yeah. So at this point, there are two kinds of tests. One is the tried and true PCR-based test. This is a very expensive equipment that very few centers have, and they look for the DNA of the virus. That is the more expensive test. There are much more newer tests being developed by companies like Roche and Gilead, and some Chinese companies as well, that are a lot faster acting. So the question of whether you should charge for the test or not, I would say is a moot point. There are government tests right now which are being provided free. There are private labs who may charge some amount. There are other labs who may charge a lot, or hospitals who may charge more. Ultimately, patients will decide based on the kind of testing methodology that they want. But what's most important is that it get opened up and not be restricted in the current criteria, which says that only if you get a clear indication, if your fever is high or if you have already many of the symptoms, that you get the test. We should start being more proactive about it so that people can proactively come and say, look, I feel fine now, maybe there's a tickle in my throat, but I just want to get the test done just in case. And so what that does is, with that certificate, it becomes a lot easier when he goes to a health system with his family member for us to say, fine, now you've been cleared, you are not likely to be a patient or a spreader of the virus, and so we can allow you in. Whereas what's happening in hospitals right now is that we are blocking a large number of people from coming in, and we're doing really outdated tests like the infrared thermometer and checking people's temperature at hotels, airports, and in hospitals. But what we've seen is that most of the time, by the time it comes to a person having a fever, it is already too late.
That's truly worrying, Viren. So all of these infrared temperature tests that we're doing everywhere, you're saying that that's not really enough to keep the virus out if there is someone infected?
Now, definitely, if a person is already showing a high fever and is highly infected, then yes, it's good to keep them away. But the fact is, most people can be spreaders without showing many necessary symptoms. And that is the case of studies that have been done on the Diamond Princess cruiser, as well as data coming out of Wuhan right now. Like I said earlier, 70% of cases were at very mild symptoms and almost non-symptomatic.
Ashish, how do you think this will pan out? Because right now, clearly, the government and the medical bodies are still deciding whether to expand the number of tests. And we won't know how this works out in the next few days. Do you see the number of tests being scaled up rapidly in India over the next few days? And if we choose not to go down that path and wait and watch to see how self-distancing works out for us, what would be the consequences in your view?
Yeah, so I expect there are a lot of very good people both in government and in the medical bodies, and they understand and they're seeing the data from around the world, and they can see that there are one of two choices. You can follow the South Korea, Singapore model, or you can follow the Italy model. So I expect the number of tests to be scaled up substantially. That means India will identify many more cases. they can be quarantined, and there is a chance that India can get its arms around this disease before it ends up infecting very large numbers of people. If there is a delay of a couple of weeks before testing really ramps up, I think the disease will become far more widespread in the community. And if you start doing the numbers of 5, 10, or 20% people needing hospital care, or even 2 to 4% needing ICU care, it will very quickly overwhelm the healthcare system. And that decision really needs to be made this week. We don't have 2 weeks to make that decision. The ramping up, using the private sector, using all methods to get more testing done, I think is urgent, and it needs to be done now.
Kiran, if you can still hear me, just, a last word from you before we wrap this up. An important message there coming from Mr. Jha that we have to decide this week and ramp up testing this week. What do you think, policy makers should be looking at immediately, even while we wait for cheaper and, easier testing kits to become available?
I absolutely agree that we don't have time on our side. I absolutely agree that we have to ramp up very, very rapidly. I really think testing is something that the private sector labs can deliver very easily and very rapidly at great scale. So I think it's very important to test as much as we can. And I think we are trying to control testing unnecessarily. In fact, in America, state governments have started saying that we are going to take the decision on whether we want to test the whole population or not. I think if the central government dilly-dallies about testing, I think state governments are going to then decide that, look, they are not going to wait for the center to decide. But I think it's very important. The good news is that the center is amenable to private sector testing at large scale, and I think we should not lose time. Time is of the essence.
Absolutely. Time is of the essence. We need to make a decision now, and with the speed with which we are moving, the good news is we have seen policymakers willing to be nimble-footed as and when they need to be. So with that speed, we can hopefully overcome this situation sooner than later. I want to thank all of you for joining us on the show this evening. And before we wrap up, just a shout out to all the medical professionals there. There have been groups of doctors willing to give their services and their responses on phone, on WhatsApp to people who just want to know what to do about their fever, cough, cold. They've been giving advice, sometimes for free. Thank you. You're doing all of us a great service, and hopefully we'll overcome this sooner than later. That's all the time we have this evening. Thank you for joining us.